welcome to Digital Health Talks. This is Megan Antonelli, and I am so excited to be here today with Joanna Strober, CEO and co-founder of Midi Health. Midi Health is a virtual care platform transforming access to specialized menopause treatment nationwide. After successfully founding and selling Kurbo to Weight Watchers, Joanna brings over 2 decades of investment experience with breakthrough companies like Blue Nile, Baby Center, and her insights on technology solutions for women's health gaps couldn't be more timely as health systems and consumers and people and patients all over are looking at effective ways to improve outcomes and control costs around this. Joanna, welcome to the show.
Thank you. Happy to be here.
Yeah, I am so excited to talk to you. I am just so impressed with what Midi Health is doing. And of course, your story as a female founder of both Kurbo and Midi Health, 2 topics near and dear to my heart. Tell our audience a little bit about, your founder story times 2 with Kurbo and now Midi Health.
I've had a long career, I guess just because I'm old, but my passion has really been things that I like to solve problems that I'm experiencing, quite honestly. For example, when I was an early venture person, and I funded Baby Center when I was 28 and pregnant, and met the founders of Baby Center, and I was like, oh my God, I need this. And I saw the same thing with Blue Nile. There was no one believed that people would buy diamonds on the internet. No one believed that, right? It was early internet days, but it was clear that buying a diamond was really hard, and getting a high quality diamond, unless you could have had a friend in the diamond district, was really hard to do. So I think about that, and both those companies are still around 25 years later because they were solving really big problems. And so what's exciting to me about healthcare is that you can find big problems and try to solve them. And, for me,
there's no shortage of problems. Right? That is for sure. Right.
But first
that's
with
amazing.
Kurbo, and then with this company, the goal was just to solve big healthcare problems.
Yeah, that's amazing. The Blue Nile thing, somehow I've done events on a lot of things. And at one point I worked for Nielsen, and they had a jewelry event, and we did this whole e-commerce for jewelers, and it was for independent jewelers to sell their jewelry online. And, how amazing. And Blue Nile was new then. And all the small retailers were trying to compete with that and figure it out. And what, to think of it now, it's so crazy. So it's amazing that you were there and kind of solving those problems at that time. So tell us a little bit. Kurbo, obviously you sold to Weight Watchers, a huge success. Tell us, how your experience kind of building and selling Kurbo has shaped, how you've approached Midi.
Yeah. So childhood obesity is a big problem, and it's a hard problem to solve. We tried to solve it before COVID, which meant that we couldn't easily get insurance coverage for what we were doing. And honestly, the most interesting thing about Kurbo, however, was not the payment model. It's the fact that if I was successful and I taught your child better habits, you didn't need me anymore. And so the better the product was, the less you would need us. And that is a really interesting challenge from a business perspective. So when we set out to think about what I was going to do next, I really wanted something with a 20-year value proposition. I wanted something that we would, start taking care of you in your 30s, continue taking care of you in your 40s and your 50s, and we build a company with a 20-year value proposition. So it wasn't, if you think about weight or dating, success means stopping. We didn't want a company where success meant stopping.
Right. Well, that's a good point. And it is, I think the women's health space now, in terms of menopause, it's sort of having a moment, right? We've got Amy Schumer and Oprah and all these folks talking about menopause and even talking about Midi Health, which is amazing. Yeah. But, as you mentioned, the insurance piece of that it's tough. And you've done that rather quickly in terms of getting coverage. Tell me a little bit about that story and kind of the coverage piece of it and how you were able to do that. Because I know a lot of digital health companies struggle.
Yeah, so I think I want to start by talking about what is menopause and what is perimenopause and what does all this mean in your body? Because there's a picture of menopause companies and what does that mean and menopause insurance coverage. But perimenopause, which just means pre-menopause, is about your estrogen and testosterone fluctuating and starting to go down in your 30s. Not, it's not for old ladies. We think of like menopause, gray hair, but it's not. It's women in their 30s and 40s. And it's the estrogen fluctuations that create a lot of havoc in our bodies. And that havoc includes the things like anxiety, depression, night sweats, painful sex, joint pain, really most of what women's care is during that age. If you ask most primary care doctors, they're taking care of women during this age is actually mostly menopause symptoms if they understand them. And so our revelation or our understanding is that you needed to combine the expertise of OBGYNs and internal medicine and essentially create a new type of women's primary care. And that is essentially how we think of this. We think of it as a way to treat women for the non-urgent things that they are taking care of, although eventually we'll do urgent care too. But think of it as women's care, not menopause care. Don't think of it as menopause care. Think of it as women's care and hormone care. And so what we realized is that we can basically become a primary care provider. And so we're a primary care provider essentially focused on women's issues. And that way we're able to get in network with insurance companies as a primary care provider. So that was our unique understanding. And so we set out and we got our doctors licensed in all 50 states, and we were able to get insurance coverage for them because we're providing care as a primary care provider in all 50 states.
And when did Midi launch?
We started taking care of patients in 2022.
Oh, wow. So, and this was sort of during the pandemic. So the rules had just changed and what have you that then allowed for you to do that, right?
Mm-hmm. Yeah,
that's awesome. Right. I mean, what timing in terms of that? And I think, in terms of what you've sort of laid out, what I find is so interesting about women's health and the way that it was traditionally kind of divided up, right, into sort of this adolescence, child rearing years, and then menopause. And the reality is that the hormonal trajectory of women, it's all tied together. And it in fact is the most important part of our health, right?
Yeah.
So as you've kind of positioned that to folks, right? I mean, where menopause maybe, at a time when menopause was less of a, sort of everybody talking about it, because has been sort of more recent. But tell us a little bit about what the response from the market was when you were saying, this is a continuum. We want to address this continuum.
It was actually really fun. We started out doing a pilot and we had 2 doctors and 150 patients, and we essentially took care of them for 3 months. And we took care of their bone health and their brain health and their menopause and perimenopause symptoms. And at the end of those 3 months, we're like, okay, we're done. Now we're going to go create this thing. And all the women panicked and they were like, no, you can't stop. You can't go away. We have nowhere else to go to get this kind of care. And so that's actually when we knew we were creating something that mattered to the world, was when we got that response. And, essentially our job is to take care of you in the way you want to be taken care of. No more gatekeeping, just essentially, no more gaslighting, just give women the care that they want, and then they will come back to you. And that's really what we're building.
Right. And I mean, it's controversial, and it's also, there's a lot of misinformation out there. And I mean, the Women's Health study of that, sort of around hormonal replacement and all of that has really sort of skewed all of this. How are you dealing with that as an organization, both with the medical community? I mean, I know now there's a lot more acceptance of the treatments, but I certainly still went to my traditional OBGYN and got the, you're still fine. It's okay. Don't worry about it. So what's the, is there, in terms of the clinical information that's coming out, the research that's being done, are you guys working on research, or are you just mostly amplifying the research that's there? Tell us a little bit about I know you do, it's like evidence-based protocols that you guys work towards. How are those, getting created, and where do you guys live within that space? Yeah,
we always start with the science and the research. I mean, there's a lot that has actually been done. So we start with the science and the research, and then we construct our care protocols on that. So, getting back to hormones, by most calculations, 4% of women in the United States are taking hormones. 4%. Approximately 95% would benefit from them. Mm-hmm. And when I say that, when I mean benefit, I mean, think about the fact that your bones, if you take estrogen, your bones don't deplete, right? It enables you to sleep better. It takes away joint pain. It can take away anxiety and depression. Often when women present, they get given an SSRI instead of hormones. But the fear of hormones is so prevalent that I think no matter what we do, most women are going to not want them. And, it's very sad that that's the case. But the reality is, sometimes we're accused of, like, if we tell people the evidence and the research, we're accused of pill pushing. Mm-hmm. And often patients are like, I don't want a hormone. And I respect that immensely. If they know the information and then they don't want it, that's fine. It's great if you make your own decisions. That's what I want. Just want you to make educated decisions that are not based on fear. There is emerging research, and it is emerging, that shows that taking testosterone or estrogen can be heart preventative, can be brain preventative, can help you with bone strength, right? These are things that are emerging, really interesting research. And my job at Midi is to give you that information. You choose what you want to take, but I want you to have all the right information and be guided by the right science.
Right. Yeah, no. And that's, I mean, it's, healthcare is hard and it's complicated. And then the coupling of, kind of social media and where people get their information and what people trust in a world where, Dr. Oz is the head of CMS and there's, lots of celebrity kind of influence that in some ways it can be very powerful, right? I mean, Oprah's, she made him who he is, and now, here we are. And so what do we trust and how do we trust that? And then of course, with these, virtual healthcare and that relationship that you can have, which can be, in some ways, your virtual healthcare provider can give you more time and more information, and be more engaging in the lives that we live. So what are you guys seeing in terms of that and in terms of the power of that, kind of virtual health as a tool to really help people, discern the, misinformation from the truth and from the science?
Yeah. So one thing that we do differently than most digital health companies is that we provide longitudinal care. So we don't think of this as one-off. You have one provider, just like the long-term relationship you used to have with your primary care doctor, right? We have one provider. You stick with that person for all the different things, unless we need to send you to a specialist. And either we can send you to a specialist elsewhere via a partner, or within our own platform, we have specialists as well. But our job is to develop a trusted relationship with you. And that is what we focus on a lot, on building that trust and building a trusted partnership where, often women will ask us a question and we don't know the answer. And we just go and do the research and we get back to them. And we have a whole lot of experts on the back end that we can reach out to. And, sometimes I'll see 5 different specialists comment on one case and give input on how one patient should be taken care of. And that's something you could never do very easily in a doctor's office. But, they can go on Slack in the middle of that visit and say, okay, here's the patient, here's her issues. Should she, what do you recommend? And she'll get 5 answers from really great specialists about how to take care of this thing. So what we're trying to do really is scale care like this. So this is a much more scalable version of care by providing it online and being able to then access a lot of other experts at the same time.
Mm-hmm. I mean, it seems like one of the things that's a little bit different about Midi from some of the other telehealth models like this, is you are taking a pretty holistic view of the patient, and you're moving beyond just menopause and into different spaces. And I think that's important because I find myself even, I've got my Aura ring measuring this, and I've got my this and that, I've got different digital health apps for every condition.
Right.
And so in the quest for kind of dealing with it in all one place or holistically, I've now got more providers. So tell me a little bit about where you guys are headed with that and what it looks like.
Right. I mean, a lot of my value proposition to payers is that we reduce the number of providers that one woman needs to have. So, right, like we train our people, and it's both through a training program and then through the specialists in the back end and using AI. We train our people to take care of everything. The average primary care provider refers 25% of their patients to specialists, right? So you go in and they say, go see this person and this person and this person. We don't do that. We take care of everything that we possibly can without sending you elsewhere. This actually came because we found that often we were sending women elsewhere and then they couldn't get into those people. And so we were sending them into the void, right? Sending someone to a specialist they can't get into for 4 months is not taking care of them.
Right.
So what we found is we can give almost all of the care, right? Not all of it, but a pretty good percentage of it by having back-end experts. So instead of going to 6 different visits with Midi, you can just go to one. And, I think of it a little bit like a V. So up here, you may have psychiatrists and psychologists, and then here's Midi. And then up here, you have specialists, primary care doctors, and here's Midi.
Right.
If you start here, you may or may not need to go to a psychologist or a psychiatrist, and we'll refer you to the right one. But we might be able to also keep you out of it. Same thing over here. And so we really want to make the care super efficient and make sure that, there's one place that you can go to.
Yeah, that's amazing. And have you, in terms of quantifying that, for the insurance companies and for, kind of that ROI and investment and value paradigm. And I noticed also, have you done that? But also it's 2-part question. I noticed also that you have on your site, that you work with providers and you work with employers. Tell us a little bit about where how that works.
Yeah. So, 50% of the women who come to us do not have a primary care doctor. The other 50% do, and we collaborate with those doctors. So we're not ever trying to take you away from your primary care doctor. We have a lot of cancer specialists who refer their patients to us for their menopause symptoms, for example. They keep going to their cancer doctor for their cancer, and they come to us for their menopause symptoms. That happens a lot. Dermatologists refer to us. Like, there's lots of different ways that we can partner. We're not trying to take your patient away. But we have the time and the expertise to deal with peri and menopause symptoms that are complicated. And that's our core function for the women who have a primary care provider. If you don't, then we can end up doing a lot more of the care that a woman needs. So, and then what we're doing is we're having partnerships with healthcare systems around the country, such as Mount Sinai and USC and Memorial Hermann. If you have cancer, for example, which we are diagnosing all the time, then we have a relationship with them to get you in efficiently to get really high quality expert care. So the way we think of it is, you come to us, we're going to get that mammogram for you. We're going to get that colonoscopy for you. We may, and we do, find cancer every day. And so then we'll make sure that you get into a cancer specialist. So the concept is that we can be this layer of care that's appropriate, and then make sure when in-person care is necessary that we get you into the right place.
Got it. Which is a perfect lead in for my next question, because one of the things I've heard you talk about, which I love this idea, is sort of how prevention or how longevity is a rebrand of prevention.
Yeah.
Right. And so what I'm hearing you say a lot of is like Midi is really it's that prevention arm. It's a lot of, yes, you've got symptoms, but a lot of these symptoms are easily managed. And a lot of these symptoms are in fact aging, but if you can prevent them, we stop the inflammation, we stop that process from happening. So tell me about that, because I know there's a lot of exciting research and conversations happening, but tell me what Midi's doing in that space.
Yeah. So what we have really learned is what you just said, that longevity just means preventing disease, right? And that is what it is. Like, it can be a really sexy name, but longevity is basically preventive care. And that is what we do. If we get you the mammogram, if we get you the DEXA scan, if we get you the colonoscopy, we are preventing you from getting sick. That is basic preventive disease, right? Prevention. We are also looking at your blood tests early. Let's see if there's things that we see in your blood tests that mean that you have issues that you need to be managing. The one thing that we found is that lots of women in their 30s and 40s, they don't think they're in perimenopause. They're not ready to say that they're in perimenopause, but they do want to be healthy grandmothers. And they do want to be around to run after their grandchildren, to take care of those grandkids, to to live the life they want when they're in their 80s. And if you do things in your 40s, you can prevent a lot of those things that happen in your 80s. And so we spend a lot of time thinking about that. When you think about women's health and all of our health, really, a lot of it is things like cancer prevention, Alzheimer's prevention, having our bones not deteriorate. Those are all longevity. That is longevity, right? In the end, you can take some supplements that might make a little difference. And there's some emerging research that I'm learning about with peptides that could help. I've come to believe that GLP-1s are probably one of the best longevity medications. And we've started doing some testing on patients that are interested on microdosing GLP-1s to see if they feel better with inflammation on that. All those things are on the border, like they matter. But really what matters is, are you getting your cancer screenings, exercise, sleep, diet, the basics, right? Those things really matter. And then for women, hormones. And that is a huge difference between women and men. Both testosterone and estrogen play a key component to our aging. There's not enough research on it entirely, but there's enough emerging research that makes me enthusiastic that we're going to find that estrogen is very correlated to Alzheimer's prevention, for example. And there are tests being done to see whether taking estrogen prevents Alzheimer's. But honestly, I'm going to have Alzheimer's, and before that is like known, right? We're all going to be dead before those tests are done. So for me, it's enough. Like, I know enough to know that it's worth trying. And to me, that is what I want women to get access to. Enough that it's worth trying. If we know there's no downside to estrogen, as long as you don't have breast cancer or a blood clot, and you know that there's perhaps evidence that it can help your bones stay strong, we know that it can help avoid Alzheimer's, it can help reduce cardiac disease, why wouldn't you do it? Mm-hmm. And so that is a big component of women's health. Also testosterone. Women have testosterone just like men have testosterone, and it also starts going down in their 30s, and there are a number of impacts on that. So if you're interested in trying testosterone, that's something that can give you certainly more interest in sexual health, but also there's some really good research that it could help with your bone health, with your mental acuity. Why not try it? And so that my way of thinking of it now is that our job is not to gatekeep, and it's not to gaslight. Like, it's just, we want to give you access to information, education, and help you to make the right choices for your body so you can stay strong. And, for me, it's about being a healthy grandmother. Like, I had kids a little bit when I was older. I want to go run after those grandkids, and I want to go read books to them. That is very motivating to me. So what can I do so that when I am in my 80s, I can, be a good grandmother?
Right. No, and that's whatever, I think that it speaks to what people care about. It's kind of ironic when I think about it, though. I feel the longevity space is sort of male dominated, right? I think of all those male podcasters and the conversations that they've had around that, and they've got, but they've been putting God knows what in their bodies forever. They'll take any supplement, anything, weightlifters and bodybuilders and all these things, there's a lot of research and work on, sort of the high doses of hormones in that place where right. Maybe there are start to be negative side effects, but there's a body of people and willingness where, sometimes when it's out of the scientific discourse, people are more willing to put things in their body. Right. And so, what excites me about Midi Health and other providers like this is where, that it comes together. And while, the gatekeeper is not there, but you do have a partner in this health. Exactly. But as I've listened to you speak a number of times, I think, well, men do need this too, Yes. They age as well. And, the car doesn't help, the new car, right. The new car and the weightlifting, it helps a little, but, they also need help, and in some ways are often not as educated in the evidence-based science side of things. So is that on your trajectory at Midi Health, or is it just women all the time?
I think we actually have men come to us now. They as female as our site looks, often it's a woman who says go to their husband, you should go try Midi, and the way I've come to think of it is that we are a HIMSS for people who want to talk. So there's plenty of people who just want a product and they don't want to talk to anyone. But there is a group of people who want to have a relationship, who want to talk about their health, who want to understand their options. And that is where we fit in. So we do have men actually booking visits and they want to come talk about their hair loss or what their options are. They want to talk about they want to talk about their cholesterol. They might want to talk about weight loss and understanding their weight loss options. So we're very much a women's health company, but it is usually spouses, and they go, "Oh, you should go talk to them too." Right. And we don't discriminate. We will take care of anyone.
Oh, good. Well, I think that's great too, and I think it is interesting. I mean, I think the way that we're, as people, as we age and as this becomes more available to people, that people will be able to take advantage of it, which is great. And so I really do appreciate the work that you guys are doing. We always like to end on like kind of what's good and what's good in healthcare. As you look at what's going on, in the healthcare space, particularly digital health or women's health, what comes to mind as kind of this is exciting and this is sort of, where you see a good area?
Honestly, I'm going to be pretty basic. Telehealth is revolutionary, honestly. So we take care of some of the most powerful women in the country, and we take care of a lot of Amazon factory workers and everything in between. And the fact that you don't have to leave your house to get good care, the fact that you can pick up you can be in the carpool lane, and while you're waiting for your child, get on a call and get some information, as long as you're not driving at the same time. The fact that women can call us, at nighttime from their bedroom closet, and actually it's transformational. There's a lot of care that people don't get because the barrier to taking a half a day off of work and sitting in a doctor's office and going to that doctor, that is a big, big barrier. I don't think you can underestimate that. And so I think that offering, just the basic, being able to have a relationship with someone online has actually and will actually continue to change healthcare. And I believe that, over the long term, most care will be delivered like this when you don't need in-person care, right? So if you need to see someone in person, if there's a physical ailment that you need, you will go in person. But I believe that over not that long, most care will be delivered like this. And I think you can actually, in many ways, have a better experience. I don't know about you, but when I go to the doctor and you have to take off your clothes and you sit on the mat and you don't really want to talk to them about your hot sweats and you just want to kind of get out of there as fast as possible. And so this is actually a much better way to have an in-depth conversation, I think. So I'm very excited about just telehealth and the basics of that.
Absolutely. Yeah, 100%. And I think, and I know you've done a lot of work going to Washington and lobbying and making sure that those laws that, were passed and sort of put into place, the regulations put into place during the pandemic stay.
Right.
Are you hopeful about that too? I am. I'm pretty optimistic that's going to go
what really
way.
Was upsetting to me is, they were considering, and it's only extended for 1 year. That requiring people to go back to an in-person visit in order to get a controlled substance prescription. And they make it sound like controlled substance is some like dangerous thing, right? But controlled substance in 7 states is gabapentin, which is something that helps women who have breast cancer so that they can sleep better. That's not something that should be difficult for them to get. But in those 7 states, there are very, very few providers who are educated on this. And to have to drive 2 hours in order to get the prescription means that women just will not get the care that they need. So I am, cautiously optimistic that this administration will realize that actually, rural healthcare is fundamental. And we need to make it easy to get access to care and not put more barriers in front of people.
Yeah, I mean, absolutely. Amen to that. And I think that, telehealth has been this sort of, the promise of access and convenience, and it really, obviously converged in a maybe not so positive way during the pandemic, but has been life-changing for so many. and that it's given them access. And women and menopause is only one slice of that in terms of how much, convenience and access it's given. So agree 100%. I do think it's revolutionizing how we approach our healthcare, and it's making it more convenient every day. So, and I think both the areas that you were focused on with Kerbo and with this are amazing. And, I think Midi Health will help to revolutionize that and make it something that people will say, don't take it away from me.
Right? Yes, exactly. That's exactly right.
Yeah. Well, thank you so much for being here, Joanna. It was such a pleasure to meet you. And to our listeners, if you want to learn more about Midi Health and maybe take care of some of your symptoms, go to joinmidi.com. And Joanna's great. She's very accessible and available. Is there a good way for folks to reach you, Joanna? Is it LinkedIn?
LinkedIn. If they reach out on LinkedIn, I'm usually pretty good at responding. Yes.
And they do a number of, I just participated in a LinkedIn Live, and she speaks all the time, so you can learn more. And of course, if you want to hear more from Digital Health Talk, subscribe to us. And this is Megan Antonelli, and it's a pleasure. Thanks so much for joining us. Until next time.
Thank you. Bye-bye.